Transcranial magnetic stimulation, or TCMS, was first developed in 1985. It received FDA approval in 2006. It is a non-invasive neurostimulatory method using magnetic waves to treat a number of psychiatric conditions as well as neurological conditions. It treats depression, OCD, migraine, and also is used in smoking cessation. In neurological conditions, it is effective in the treatment of stroke. TCMS relies on two basic principles of physics, that is, electricity and magnetism. So it relies on these two principles working together. When a magnet is introduced, there is a field around it that is magnetically active, and the space surrounding the magnet is a magnetic field. When the magnetic field comes in contact with a surface that conducts electricity, the magnet induces electrical waves, and these electrical waves further bring about the action of the device. When the magnet is brought near a conducting surface that conducts electricity, the interaction between the magnetic field and the conducting surface generates electricity. So when a magnet is brought near the scalp, the electricity generated is utilized by the neurons to relay information forward. And hence, this influences the magnetic or the electrical current influences the brain cells. And this is used to target certain areas of the brain, such as areas of pleasure, areas of decision making, and area of emotion. TCMS depends on this magnetic field. The magnetic activity depends upon the strength of the magnetic field. It depends upon the pulse frequency and the pulse pattern, and also the magnetic coil. The magnetic strength is measured in Tesla. Usually in TCMS, the magnetic strength is 1.5 to 2 Tesla. The pulse frequency is the number of pulses per second, and it extends from 1 to 15 Hertz. Hertz is the unit used to describe the pulse frequency. And the pulse pattern also influences the magnetic activity. This is similar to the magnetic activity in an MRI. But the difference between an MRI and TCMS is the smaller magnetic field in TCMS. The pulse frequency is the number of pulses per second. It is measured in Hertz, and this in TCMS is from 1 to 5 Hertz. The pulse frequency is the number of pulses in a second. So in TCMS, it is up to 15 pulses per second. And the magnetic coil also influences the magnetic activity. A deep magnetic coil or a deep extended magnetic coil applied deeply is used in the treatment of obsessive compulsive disorder. TCMS is safe, effective, and can work concurrently with other treatments. TCMS treatment involves a different number of sessions. Each session lasts up to half an hour. The sessions are usually conducted up to 6 sessions a week, and the maximum number of sessions are about 30. Thus, TCMS has life-saving potential that offers immense hope to people with treatment-resistant depression and other disorders where pharmacological treatment is insufficient.